Hi, I'm Dr. Raphael Wald at Palm Beach Psychology Associates. Today I'm going to be talking about dementia and Alzheimer's disease. A lot of people ask me what the difference is between dementia and Alzheimer's disease. What I tell them is the way to think about dementia is that it's a large umbrella category. The definition of dementia is it's a person who has an impairment in their memory skills as well as one other cognitive or thinking skill. So for example, a person might have an impairment in their memory and their attention skills. They might have an impairment in their memory and their word finding skills. The medical term for word finding and language problems in general is called aphasia. So there are a number of other different kinds of problems that a person can have along with memory that would make them meet criteria for having dementia. And there are a number of different causes of dementia. So for example, by far the most common cause of dementia is Alzheimer's disease. Alzheimer's disease is related to a specific kind of a pathology or an abnormality in a person's brain which typically accumulates as they get older and older. There are a lot of other causes of dementia, as I mentioned earlier. For example, there's vascular dementia, which is when a person has strokes. Now, it could be one very large stroke, or it could be a lot of small strokes that leads to vascular dementia. There's also dementia which is due to HIV disease. There's dementia which comes as a result of head trauma, either one major head trauma or numerous head traumas, which is what we're seeing in the NFL and in football in general, is people that sustain numerous concussions or subconcussions, meaning a head injury that just barely is not quite a concussion. Over time, they can develop dementia and a lot of other serious psychiatric symptoms as a result of those head injuries that they sustain. Some forms of dementia are treatable and reversible, while many others are not. As you probably figured, Alzheimer's disease is one that's not reversible. There are medications that we use which can slow the progression of the disease, but we still certainly are searching for a much better treatment for Alzheimer's disease in general. One thing that people become confused about is something called pseudodementia, which is a form of dementia that comes on when a person is suffering from depression. This is obviously something that's reversible, and it's not caused by what we call an organic brain disorder, meaning there's nothing identifiable as in with Alzheimer's disease that we can point to and say, yes, this is clearly the pathology or abnormality that's causing this person's dementia. In that way, pseudodementia really isn't quite dementia, it's pseudodementia. It's showing signs and symptoms that are kind of like dementia, but once a person comes out of their depression, these symptoms typically resolve. And that is dementia. Thank you very much.